Hello everyone, thank you for joining us. Today we're going to do a presentation for you on pregnant women's health. My name is Miranda Keifer, the community health worker out of the Norfolk office, and with me I have
Katy Yunker, the community health worker out of the Niobrara office. So, as we know, not all pregnancies are planned. Birth control and contraception are not 100% guaranteed to protect you from unwanted pregnancy and STDs. If you are sexually active, it is important to identify your reproductive plan to help achieve pregnancy or prevent any unintended pregnancies. Unplanned pregnancy is associated with an increased risk of problems for both the mom and the baby. If the mom was not planning to get pregnant, she may have unhealthy behaviors which could affect the health of the baby or delay getting health care during pregnancy, which is why it's important to know your options for family planning if you or your partner do become pregnant. Preconception. If you are trying to have a baby or just thinking about it, it is not too early to start getting ready. Having a baby is an exciting time that often inspires women to make healthier life choices. Preconception health focuses on things you can do before and also between pregnancies to increase your chance of having a healthy baby. Before getting pregnant, talk to your doctor about preconception care. Your doctor will want to discuss your health history, any medical conditions you currently have that could affect a pregnancy. He or she also will discuss any previous pregnancy problems, medicines that you are currently taking, vaccinations that you may need, and steps you can take before pregnancy to prevent certain birth defects.
And then on to prenatal. So with prenatal, now that you're pregnant, it's time to schedule your first appointment. And usually most doctors will have that done between 8 weeks is usually when your first one would be, unless you're high risk or you're having other complications that you're noticing, then get in as soon as you can. And so during the first appointment, they're going to ask about your health history, ask about your family's history, and maybe do a complete physical exam to make sure you're well, do a pelvic exam, and maybe a pap test as well. They'll take your blood and urine for lab work, test your hormone levels and all that good stuff, check your blood pressure, height and weight, and calculate your due date, and then answer any questions you may have. And we have services available, at our Ponca Health and Wellness Center in Norfolk, Fred Leroy Clinic in Omaha, and now our Ponca Health Service Clinic in Lincoln.
So pregnancy is divided into 3 stages or trimesters. Your first trimesters will be between weeks 1 and 12. At your first prenatal appointment, like Miranda said, they'll take your weight and your blood pressure. They'll test your urine for sugar and protein levels. They'll check for the baby's heartbeat. They'll measure the size of your uterus, and then to see if any of your hands or feet are swelling. So the first trimester, a woman may not even realize that she is pregnant until later into her first trimester. This is especially the case if women do not have regular menstrual cycles. During the first trimester, your body is dealing with many hormonal changes that can affect your body's function and organs. Some common symptoms women have in their first trimester include fatigue, nausea, vomiting, mood swings, tender or swollen breast, heartburn, headaches, weight gain or loss, and the need to urinate more often. Most of these symptoms will dissipate as the pregnancy progresses. You may experience one, all, or none of these symptoms. Each woman is different, and so is each pregnancy. What you experience during your first pregnancy may be totally different than your second or third. Nausea is the most common issue women deal with during the first trimester. Typically, women are advised to eat small meals that are low in fat and non-greasy foods, drink plenty of liquids, and then wearing an armband that helps with motion sickness may also help. And then your second trimester consists of weeks 13 through 27, and at your prenatal appointment, they'll measure the baby's size, and they will check their major organs. They'll measure the growth of the baby, they'll listen to the heartbeat again, fetal movements, and check for any abnormalities. They'll also check your amniotic fluid, which is the fluid surrounding the baby, and then also the location of the placenta. Many women find they begin to feel better during the second trimester. Often the nausea and fatigue from the first trimester ends, or is not as severe. Healthy eating is always important, but especially when you're pregnant. So make sure your calories come from nutritious foods that will contribute to your baby's growth and development. A normal weight gain during pregnancy, during the second trimester, is usually 3 to 4 pounds a month. This may vary more or less depending on your BMI. And then also your breast tenderness should subside, but they will continue to grow due to them preparing for milk production. You may experience more leg cramps. This usually occurs at night and can get worse as you get further along into your pregnancy. And then further along in your second trimester, you might also experience Braxton Hicks. This is when your uterus begins to contract to prepare for the baby. And they usually are very weak and not painful. Contact your physician if the pain gets worse, or you maybe experience preterm labor. Also, during your second trimester, women are more likely to get kidney and bladder infections. This can be due to the rising hormone changes in the body. Just make sure you're drinking plenty of water and fluids. Studies have shown that taking folic acid supplements 1 month prior and throughout the first 3 months of pregnancy decrease the risk of neural tube defects. Neural tube defects form during the first several weeks of pregnancy, possibly before the woman even knows she's pregnant, goes to become the baby's developing brain and spinal cord. When the neural tube doesn't form properly, this may result in tube defects such as spina bifida. And then hydration. It's important to drink plenty of fluids, especially water, during pregnancy. A woman's blood volume increases dramatically during pregnancy, and drinking enough water each day can help prevent common problems such as dehydration and constipation. And then exercise. Exercising during pregnancy has been shown to be very beneficial. Regular exercise can help prevent excess weight gain, reduce pregnancy-related problems like back pain, swelling, and constipation, improve sleep and increase energy, boost your mood, prepare your body for labor, and lessen the recovery time after birth. Low-impact, moderate-intensity exercises such as walking or swimming are great choices. You can also try yoga or Pilates, videos or exercise apps or videos that are tailored for pregnancy. And just make sure that these are low impact and they work on strength, flexibility, and relaxation. Whatever type of exercise you choose, make sure to take lots of breaks and drink plenty of fluids. Slow down or stop if you get short of breath or feel uncomfortable.
And you can always ask us to help you figure out some that may work for you. Or the dietitian as well may also have those resources available.
It's important to get enough sleep during your pregnancy. You'll probably feel more tired than usual. As your baby gets bigger, it'll be harder to find a comfortable position when you're trying to sleep. Lying on your side with your knees bent is likely to be the most comfortable position as your pregnancy progresses. It also makes your heart's job easier because it keeps the baby's weight from putting pressure on the large blood vessels that carry blood to and from your heart and your feet and legs. Lying on your side can also prevent and reduce varicose veins, hemorrhoids, and swelling in your legs. Some doctors specifically recommend that pregnant women sleep on the left side because of those big blood vessels on the right side of your abdomen. Laying on your left side helps keep the uterus off of it. Laying on your left side helps blood flow to the placenta and therefore your baby. So your third trimester consists between weeks 28 to 40. During your third trimester, your prenatal visits will be every 2 weeks until the last month of your pregnancy, when you'll have them every week. The doctor will check for varicose veins in your legs. They'll do a glucose screen test, a group B strep test. They'll test your blood for anemia, and then they might also ask you if you're having any other symptoms, such as Braxton Hicks, contractions, anything like that. And just like your previous visits, your healthcare provider will check your weight, your blood pressure, and ask, any signs. So you may have to be vaccinated during the third trimester as well. And then usually women are recommended to get the Tdap vaccine, ideally during the 3rd trimester. This can help prevent your baby from whooping cough before he or she can be vaccinated. And if you haven't received the COVID-19 vaccine, studies have shown that it doesn't pose any serious risk for pregnant women or their babies. And then vaccination can help prevent women build those antibodies that protect their babies. Your healthcare provider will also check your baby's size and heart rate, and you'll also be screened for various tests such as gestational diabetes, which is a type of diabetes that develops during pregnancy. Prompt treatment and healthy lifestyle choices can help you manage your blood sugar level and help you deliver a healthy baby. They'll also do the iron deficiency anemia test, which occurs when you don't have enough healthy red blood cells to carry adequate oxygen to your body's tissues. Anemia might cause you to feel very tired. To treat anemia, you might need to take extra iron supplements. And then they'll also test for group B strep, which is the type of bacteria that lives in your vagina or rectum and can cause serious infection for your baby if they're exposed to it during birth. If you test positive for group B, your healthcare provider will likely recommend antibiotics while you're in labor. So preparing for labor, near the end of your pregnancy, your healthcare provider will also check your baby's position and ask about your baby's movements. He or she might also ask about your preference regarding labor and pain management as your due date approaches. Knowing what to expect can help you have the most positive birth experience. If you have specific preferences for labor and birth, define your wishes during your birth plan. Review the plan with your healthcare provider, but keep in mind, pregnancy problems may cause plans to change. Most babies turn into a head-down position between the weeks of 32 and 36, and some don't turn at all, and others turn into feet or bottom first position. Most doctors will try to turn a breech fetus into a head-down position using an EVC method, in which a doctor will try to gently shift the fetus by applying their hands to the mother's abdomen using an ultrasound guidance. The baby will be monitored during the procedure to be turned. They are often successful and can reduce the likelihood of C-section delivery. Labor and delivery. Labor is a unique experience and unpredictable. You won't know how labor and childbirth will unfold until it happens. For first-time moms, the average length varies between hours to days. However, you can prepare by understanding the typical sequences of events. So there are some different birthing options. Vaginal birth is when your water breaks, and you will have the early stages of labor or active labor at home, and that's when you're feeling persistent contractions, and then when they become stronger and frequent, you will more likely go to the hospital then. And then natural birth is usually for women who are low-risk pregnancies, and then they may choose to have a natural birth to avoid possible risk from medicine. Natural childbirth is a way of giving birth that lets nature take its course without medicine instead of using technique. They'll use techniques of relaxation and controlled breathing for pain. And then your scheduled induction. So if you have gone past your due date, or if it's medically necessary, your doctor may schedule you for an induction where they will be giving you medicine to start your labor. And then sometimes, circumstances of labor and delivery change, and a cesarean birth becomes necessary for the health and the safety of the mom and baby. Your physician and healthcare team will explain the process of a cesarean and then help to prepare you for the procedure. And then there's also a scheduled cesarean. So this is usually for women who have previously had unplanned cesareans. And this is, the same way. Usually a C-section is a surgery, which the baby is born through a cut that your doctor makes in your belly, in your uterus, to deliver the baby.
And then we have postpartum care after you go all through all those steps. And with postpartum care, it's usually the first 6 weeks after childbirth. And it's a joyous time, the no sleep and all of that, just so joyful. But it's also a period of adjustment and healing for us mothers. And then during these weeks, you'll bond with your baby and you'll have post-delivery checkup with your doctor. And then most mothers don't return to work for at least the first 6 weeks after birth, if you're lucky, longer. And then this allows time to adapt and develop a new normal with you and baby and family. And since a baby has to be fed and changed often, you may experience sleepless nights. It can be frustrating and tiresome. And then the good news is that you'll eventually fall into a routine. And in the meantime, here's what you can do to make it a little easier of a transition. You get plenty of rest. I know that sounds crazy, but when you can,
Sleep when the baby sleeps.
Yes. When you have family, seek help. We all need help sometimes. So that's where family comes in, friends come in. Don't be afraid to ask. We are super women, but we still need help sometimes. And then make sure you're eating as healthy as you can. Maintain a healthy diet to promote healing, to increase your intake of whole grains, vegetables, fruits, and protein. And then you should also increase your fluid intake as well. Stay hydrated. And if you can, exercise, doesn't have to be too high impact. Those moderate impact exercises, yoga, chair exercises, and it just helps you out all around. And then, like I said, we do have our clinics available for everybody. You can always call one of us community health workers to help point you in the right direction. We do have in Omaha Dr. Rosenbaum, who is available. He is our pediatrician, and he is in Omaha, and then he comes to Norfolk as well on Wednesdays. So feel free to reach out, and thank you for joining.
Thank you.